Hi everyone, today's presentation is about missed miscarriages or silent miscarriages. And this is a triggering subject, so if this is close to you, please do be mindful and if necessary, pause during this presentation. A silent miscarriage occurs when a fetus is no longer alive. It didn't form or is no longer developing, but the body does not recognize the pregnancy loss or does not expel the pregnancy tissue, so the placenta and embryonic tissues are still in the uterus. The person continues to experience signs of pregnancy instead of experiencing classic signs of a miscarriage like vaginal bleeding, heavy cramping, and expulsion of fetal tissue. However, some may notice that their pregnancy symptoms like breast tenderness, nausea, or fatigue become less prominent, frequent, or disappear completely. Some women may also have brownish or red vaginal discharge. If the patient wanted the pregnancy, knew about it, and did not have a history of recurrent miscarriages, when they get the news, they suffer the shock of seeing their fantasized future disappear, and what was true becomes untrue. The embryonic tissue will pass and the miscarriage continues naturally in more than 65% of cases. But if this is not successfully done as a natural process, the patient will need medication or surgery to pass the embryonic tissue and placenta. The latter leads to further confusion. If the patient does need medical or surgical assistance, they may feel like they are aborting their pregnancy, and this leads to heavier negative psychological symptoms. The way the healthcare professionals handle and manage this situation is key to how the patient will remember this experience in the future. The time it takes to physically recover from a miscarriage varies. Normally, it takes a few weeks to a month, but some people may take more time. It just depends on that person's particular history and experience. Your periods normally return in 3 to 6 weeks' time. However, the emotional recovery time can take longer, and that's what we are going to be focusing on. When a silent miscarriage or missed abortion, as it can also be called, happens, often the woman does not know it is happening. The pain felt is psychological and emotional, which in turn can lead to physical symptoms when patients receive the news, like panic attack-like symptoms, which include increased heartbeat, uneven breath, and sweating. And then other symptoms may occur when they have to process and grieve over what happened. And this can be like lack of appetite and difficulty sleeping when we are talking about the emotional side leading to physical symptoms. However, symptoms are also very varied, and this changes from patient to patient, but it is very important to be aware of what this person is going through and what are the differences that they are experiencing in their day-to-day lives and in their normality. When patients require medical help to finish the miscarriage process, differences in physical symptoms do not significantly influence patients' subsequent emotional responses, meaning that pain plays into the experience, but it does not mean that someone who experienced less pain has less painful memories or has a happier present just because of it. Post-miscarriage, patients tend to feel scared regarding future pregnancies and their outcomes and blame themselves and their bodies for the loss that happened. Studies show that in follow-up appointments, if professionals do not discuss openly what the patient felt and promptly refer them to appropriate psychological help services, this will worsen their mental health prognosis. In order to characterize the experience that patients may be having, we are going to use two concepts: whether the miscarriage can be pinpointed to a definite cause or not, and whether the patient accepts or not what happened to them. We'll start by discussing the no identifiable cause for the miscarriage versus identifiable cause parameter. A clear cause for the loss helps the patient understand the origin of what happened and helps in the emotional recovery process, as it can help piece together the narrative of the loss. And this decreases anxiety and future fear, but only slightly, and especially when we are still in the beginning of this recovery process. An overanalysis period of what the patient could have done better or different to prevent the loss will happen. Patients will very frequently try to find an answer themselves, even if the doctors say that the reason for the loss was not related to anything that they did. However, if the loss happened due to something the patient did, the grieving process is much longer, more complex, and painful to the patient, as they have to accept that not having all the knowledge to act in the best way possible or having made a mindless mistake is not a synonym of purposefully killing a baby. Some causes may not have a definite treatment or cure, so if the person did have a miscarriage and we know what happened, it's understandable that the patient will fear the future, will fear a new attempt to get pregnant. And if they cannot try again, if the reason leads them to not be able to pursue this again, then another grieving process will start, and pondering the next steps in terms of their fertility journey are very important to explore, and understanding how the future will look like should be something that we motivate the patient to do when they are ready to do so. Irrational blame often still happens, even if the patient knows that the loss was not due to something that they did. And here we can hear different narratives, but we do hear this in both female and male patients, meaning that doesn't matter who was carrying the baby, the loss is felt in everyone that was attached to that pregnancy. If the reason for the loss is due to the patient's own factor, then the self-blame tends to be higher. If the reason for the loss is due to the partner's factor, if we are talking about a couple that's trying to conceive, then blaming the partner and feeling resentment can occur. We can also see cases of impaired intimacy and compensatory behaviors, meaning that it's sometimes very difficult to have sex again, and we fear that experience because we fear the consequences of their experience. And we can also have compensatory behaviors, meaning that we can have maladaptive coping mechanisms, and we need to be wary of anything that's not beneficial to the person, that's detrimental to their lives, and that they are doing in order to cope with the loss. This can include drinking, for example, or smoking. The cause identified may dictate the next medical decisions in the journey, as I had already said. But if we are talking about a lack of clear cause for the loss, then again, we have fear to try again, and we have high levels of anxiety, of course. And patients almost as a default blame themselves for what happened. It's easier to pinpoint a reason for what happened that was under their control, even if that means they are to blame, than to think that what happened has no reason and they could not have controlled what happened, because it means that in the future the same thing may happen and they will not be able to control it. So patients may tend to find a narrative that makes them be in control when actually that's not the reality. And without a clear cause for what happened, patients may have a wider space to imagine what happened, and their thoughts can become more negative and more gruesome than what the reality actually is. We can also have an obsessive research to find a reason, so it's different than an overanalysis. Here, patients really seek an understanding of what happened, especially to understand if they could have prevented what happened. Again, we can see impaired intimacy and compensatory behaviors. And it's important to understand that the causes of abortion are usually unknown, but most commonly are attributed to fetal chromosomal abnormalities, and the rest due to modifiable etiologies and risk behaviors and factors. However, it is important to understand that the great majority is due to chromosomal abnormalities and not to something that the patients do. It's also very important to understand that feeling high levels of stress does not cause miscarriages. And I'll say this again. There is no evidence that feeling high levels of stress causes miscarriages. Now we are going to talk about the other parameter, which is the accepting or not accepting that a loss has happened. It's absolutely normal to try and find reasons for what happened, and not always do patients seek reasons in what's evidence-based or what it's scientific. Sometimes they try to seek reasons that are in a more immaterial perspective of life. We can hear things like, I accept what happened to me, and I do not seek any further explanations that are regarding a higher power. And normally this can mean God, the universe, fate, and a lot of narratives try and diverge from scientific findings to find an answer that's easier to understand in terms of, I deserve that this happened to me, or maybe God is mad at me, or maybe this is karma. And so in the first example, we have someone that accepts and is not seeking further explanations. And this is a person that has a good trajectory. So they accepted it and they are not going insane trying to find impossible answers. We have another example, which is, I accept what happened, but I seek further higher power explanations. And this person sometimes might engage in a lot of exploratory thoughts of things that don't have proof. We don't have proof of God, of karma, of fate, and engaging in these narratives is okay, but we need to be careful if they are not harmful, if the patient is not blaming themselves, thinking, oh, I deserve this, or God does not like me, because these things can stir into other problems or more deep-rooted things. I do not accept what happened, and that's why I seek further higher power explanations. And this is the most common one. It's the, I cannot accept this, and so I need explanations that the doctors cannot provide me because what they are saying is not enough. And again, this is a bit of a loaded sentence, and we need to be careful about what this means. And it's important to explore this. It's important to not be afraid to get into it and ask exactly what are these explanations that the patient is seeking, and we'll try to understand them together. Again, God, the universe, fate, karma, etc., all of these things might exist, but we do need to clarify what this means to the patient, what this means to them feeling like they deserve what happened or feeling like they are less worthy, or what does this mean to their self-concept and self-esteem, etc., etc. And the last example is, I do not accept what happened and I do not seek higher power explanations. And this is a very, very rare one. So it's only for those people who are trying to seek more medical explanations and are not trying to steer away from science. But although this makes sense, it's not something that I have found very often. Often people want to cling on to hope, and that's not always what medicine says. But then again, it's possible to not accept what happened and still try to be very rational about it and seek answers. Now, if we combine someone that has an identifiable cause for their miscarriage and accepts what happens, this is a very good prognosis. This is someone that will probably be able to try again, that needs some time to digest what happened, but is probably more functional to face what's coming. Of course, let's be clear that someone may accept and then not accept something. Okay, we can today accept what happened to us and tomorrow be filled with doubt again. And this is very common in grieving processes. And I have a video about that already, and I will probably talk about this further in the future. But if we are inside this green oval, then that's very good. It means that we are able to accept what happened and we understand what's the cause of our miscarriage. Then again, the cause itself might dictate how we feel about the situation because it might dictate our further attempts to get pregnant. And then we have the red oval that has the no identifiable cause and the non-acceptance stance upon what happened to us. And this is very challenging because normally, as I said, people will blame themselves and will try to find reasons that we don't have proof of. And it can be very damaging and deteriorating to the person to start spiraling out of control if they are trying to seek these answers. Normally, it's important to have a safe space to talk about these things, allow the person to hypothesize about what happened, and at the end of the day, provide them with coping strategies, with exercises, with tools for them to handle their day-to-day life, and not have a quality of life that's too diminished. And basically, this process might take longer and it might require a bit more of you as a mental health care professional. Lastly, I just wanted to have a pie chart example of what life is. And we think that life is made of perfect slices and we just fit a loss or a silent miscarriage in this pie of life. But that's not exactly what happens. The truth is that we have all sorts of slices and we have all sorts of colors and sizes. And a silent miscarriage can be something that's very shocking. It's not something that we are expecting. There's not a lot of research about the emotional outcomes and the psychological outcomes of a silent miscarriage, but the truth is that trying to integrate this into our lives can be quite complex. So looking for a professional that has experience in this matter is very important in order for you to have the most complete and delicious pie of life that you can. So this is our presentation for today. Thank you so much for listening. And if you'd like to leave a comment or if you'd like to contact me, you can check out my Instagram, Beatrice_Regina_fertility, and you can email me through this email, beatrice@efp.clinic. Thank you so much again for listening, and I'll see you next time.